Hello, and thank you for joining us for today's hybrid education program at CSC South Bay. My name is Rebecca, and I'm the program manager, and I welcome you to this workshop titled Sleep Strategies for Better Nights and Brighter Days. Before we begin, if this is your first time joining us, CSC South Bay's mission is to uplift and strengthen people impacted by cancer by providing support, fostering compassionate communities, and breaking down barriers to care. Our vision is that everyone impacted by cancer receives the support they want and need throughout their experience. We serve the South Bay, Long Beach, and Orange County area all at no cost. Our program includes support groups, networking groups, healthy lifestyle classes, social activities, and educational programs like this workshop. Educational programs are open to all. If you'd like to hear more about our services or join a community, please visit our website at cscsouthbay.org. Before I introduce today's speaker, we ask everyone in person and online to keep your microphone muted to eliminate any distracting background noise. For those online, please feel free to enter any general questions into the chat, and I can read them out loud at the during the pauses at the end. And for those in person, we'd appreciate it if you can hold your questions until the end, unless Colleen has pausing points. All right, without further ado, I'd like to introduce our workshop speaker. Colleen is an oncology certified nurse practitioner at UCLA with 12 years of oncology experience. She enjoys incorporating non-pharmaceutical modalities into her oncology practice to optimize patient outcomes. Thank you so much, Colleen, for being here with us today.
Thank you, Rebecca. So we spend a third of our lives sleeping. So we're going to talk today about just ways to optimize that sleeping so that you're more alert during the daytime. And to be honest, I'm going to go over a lot of recommendations. I have nights that I don't practice all of these things, but I'm hoping that you can at least find, even one or two little things to help incorporate into your day-to-day lifestyle and nighttime routine to make sure that you can get a little bit of better sleep. Alrighty. So first off, why does sleep matter? Especially for oncology patients, sleep's essential for healing, immune function, and emotional well-being. Poor sleep can worsen fatigue, pain, and mood, and quality sleep supports better treatment outcomes. So how much sleep do we need? Adults need 7 to 9 hours of sleep, and adults older than 65 actually only need 7 to 8 hours of sleep. Cancer patients can oftentimes need more rest, but it's really important to prioritize quality over quantity because oversleeping can actually throw off your circadian rhythm and make you more tired during the day. So I oftentimes get patients who are saying, I'm sleeping 11 hours at night and I'm just constantly tired. Well, you're actually doing more harm than good sleeping over that 9 hours a night. So we'll talk about, ways that if you still are waking up sleep deprived, feeling sleep deprived, how to kind of time out napping so that you're still getting more rest without setting off your circadian rhythm. Common sleep problems that we can have: insomnia. I'm sure most of us have been on steroids at one point or another. It's really important, especially if you're taking once-a-day steroids, to try to take them first thing in the morning because just with the way that cortisol works, if you can get it first thing in your system, that will lessen the side effect of insomnia. Fragmented sleep. A lot of times patients or people in general wake up in the middle of the night to urinate. Daytime sleepiness and restless legs and discomfort. So what interferes with sleep? Pain or discomfort, anxiety, depression, stress, and then side effects of medication such as steroids. Also, hot flashes or night sweats. A lot of times if you're on a hormone treatment, that can exacerbate nighttime sweats. And also, unfortunately, if you're going through menopause, you kind of are doubling up on hot flashes at nighttime. Also hospital environments. I'm sure all of us have tried to sleep overnight in the hospital, and it's impossible. Between all of the lights, the alarms, the bed quality, and being woken up on usually an hourly basis. Now, unfortunately, having worked in the hospital and worked night shifts, it is a liability of the hospital to be checking on you on an hourly basis. So it's kind of a double-edged sword that, you know, being in the hospital, it's almost making it impossible to get a good night of sleep because of the liability aspect. Um, if you are in the hospital, I always recommend, if the hospital doesn't provide them, to bring earbuds, bring a face mask, you know, try to do little things that you can. Usually you can talk to your nurses and say, you know, can you try to compartmentalize my care so that, you know, I can get these chunks of sleep if possible. Or if you wake up in the hospital to use the restroom, say, can you grab my vital signs right now? Or, you know, if I need nighttime medications, you know, use the call bell, ask them, can you do everything right now while I'm awake? So, you know, inevitably, right when you go back to sleep, they're not waking you up again. All right. There's my tangent about that. So sleep hygiene. Keep a consistent sleep schedule. Try to go to bed at the same time each night, or plus or minus an hour. We always think about with daylight savings time how it really affects your routine. If you're doing that to yourself on your own accord, you know, you're having that kind of jet lag sensation. So try to, you know, give yourself a bedtime. Create a restful environment, dark, cool, and quiet. Limit screen time before bed. We'll talk more about this. Avoid caffeine late in the day. So the recommendation is to stop caffeine 6 to 8 hours before you go to bed. So if you're going to bed at 10 p.m., stop drinking caffeine at 2 p.m. Or, you know, similar. Obviously, caffeine affects everybody differently, but it really is helpful to, you know, try to minimize late in the day caffeine. Also, avoid nicotine at least 2 hours before bedtime, and heavy meals 1 to 2 hours before bedtime. And that's related to, you know, your digestion. You don't want to have any heavy digestion before bedtime. All right, so we live in a technological age. Blue light, it actually affects your melatonin and delays circadian rhythms, making it harder to fall asleep and reducing sleep quality. So the blue lights are on televisions, on screens, on your phone, on your iPad, because it wants to make you alert. Well, that's not conducive to falling asleep at night. So to protect sleep, avoid bright screens 1 to 2 hours before bedtime. Use dimmers, warm lighting at night, and consider blue light blocking glasses or device filters. I have my phone here, so I have an iPhone. And if anyone wants to do this right now, I'll show you. If you go into your settings, so it has that little cog wheel. If you go into settings and scroll down to displays and brightness. Again, I have an iPhone, but it's similar on Androids or other devices. It has a little blue sunshine that says display and brightness. Scroll down and there's a night shift option. And if you go into that, you can either choose for it to just be manually at nighttime with sun up, sun down, or you can schedule it. For example, for me, I have it scheduled from 9 p.m. to 7 a.m. So for that 1 hour before you go to bed, 1 to 2 hours, to turn that on, all it does is it still allows for you to use your phone, but it blocks some of that blue light. Honestly, I don't even notice a difference, but it's really helpful that it's just one little thing that you can do to make sure, especially if you're somebody in the middle of the night, and you shouldn't do this, but you know, you wake up, most people sleep with their phone at their bedside and look at their phone to see what time it is or if they have any alerts. I recommend to turn off your phone over nighttime so that you're not getting alarms. But yeah, this is a simple thing. You could also do it on smart televisions and on iPads. So there's more information here, and I'm happy to help anybody at the end of this presentation set that filter. So creating a sleep-friendly bedroom. Have a comfortable mattress. Again, we're spending a third of our lives in bed. So, let's maybe, spend a little bit more on a good mattress because it's worth it. Pillows, blackout curtains are really nice, especially with sunny California, or wearing an eye mask and keeping the room cool. So the optimal temperature is actually 60 to 67 degrees Fahrenheit, which especially in the winter time, a lot of times we're blasting our heat because it's getting chilly. But that's been shown to be optimal temperature so that you can get into that circadian rhythm and keep it. So I don't know in your homes, if you have the ability to set a thermostat at a different temperature in your room versus the rest of the house, or some of these, smart dials allow for you to set a certain time frame for it to go down in temperature. And, it's also going to help your heating bill. Daytime habits for better sleep. So getting sunlight exposure first thing in the morning is actually best. It takes about 30 minutes of sunshine a day to get optimal vitamin D levels. And that's first thing in the morning. So depending, it all depends on everybody's circadian rhythm is a little bit different based on when they wake up and when they go to sleep. But a lot of times, especially, it's really good, if you have a dog that you can take it walking first thing in the morning, or, just take a walk around your block. Or if you have the ability to eat breakfast outside, that's really wonderful. In a lot of cultures, that's what they do. They eat breakfast outside. And just getting that extra vitamin D first thing in the morning can help kind of set your circadian rhythm throughout the day. And like I said, it's usually 30 minutes is all that's needed of that sunshine. And even in sunny California, sometimes it's been shown that as little as 10 minutes is all you need. Also, earlier in the day, there's less UV radiation at that time. So, it's helpful that you don't have to worry about that. Yes?
That would help. Sunglasses, I'm guessing.
It doesn't affect it's more so for the vitamin D absorption in your skin. No, not necessarily. So I would recommend sunglasses, but certainly if it's, early in the day and it's not as sunny, use your discretion. Oh, yes, sorry. We are asking about if you need to wear sunglasses, and it really doesn't matter because, again, the vitamin D absorption is through your skin. And then for optimal timing for sunlight, and that just depends on your sleep wake schedule. So first thing in the morning, but I would say, in the first 2 hours that you're awake. And then stay physically active throughout the day as tolerated. I'm sure most of us have realized that, when you have really active days, you're tired at night and you sleep better. So exercise, try to exercise earlier in the day. That's another thing. Usually they say about 4 hours before bedtime, you want to limit a lot of exertion. Reserve bed for sleep and intimacy only. So, again, with technology, a lot of people these days have TVs in their bedroom. You shouldn't have your television, again, for the 1 to 2 hours beforehand. If you do, set that blue light filter. But if you have a TV or a desk, I have my work desk in my bedroom. So you just really have to make sure you're, staying away from the bed. It looks cozy, but, try to focus on that part of your room and keep your bed for sleep and sex. So that's it. And then again, at nighttime, if you're reading in your bed, that's okay. But, be in your bed at the time that you're kind of getting into that bedtime routine. Healthy napping. So we all like a good siesta. Short naps are ideal. So 10 to 30 minutes. And that's the time that you're really asleep. So if it takes you a little while to get there, 10 to 30 minutes is the time that you want to be asleep to obtain that REM cycle, and that's it. You want to sleep earlier in the day. So optimal timing is 1 to 3 p.m. And you want to try to be awake before 3 p.m. So if you're taking a later nap, try to be awake at 3 p.m. because, again, Otherwise, it can affect your circadian rhythm and make it harder to fall asleep at nighttime. And this, again, aligns with your circadian rhythm and dips and minimizes the interferences with nighttime sleep. So managing pain and discomfort, oftentimes, especially in oncology, we're kept awake by ongoing pain. Take pain medication as prescribed, use supportive pillows. I have patients that sometimes will get pregnancy pillows, which, you know, are these big U-shaped things just to utilize, and they're terrific to, you know, push in between areas that might be because of tumor burden or what have you. Really helpful to just give that extra support. Gentle stretching and relaxation before bed is also incredible. Again, no extreme exercising, but just simple like supine twist over left and right, sit in a chair, do some simple back stretches, neck rolls. Those sort of things can really just kind of calm down muscles and allow you to sleep a bit better. Managing hot flashes and night sweats, wear breathable clothes, cotton, there's a lot of breathable cotton, silk, bamboo. Bamboo is an excellent fabric that's really breathable. And that for sleepwear, also for your bedding is excellent. I use a silk pillow because it's good for your hair. Yes, it's great. It makes your hair not frizzy, and it's also really wonderful, you know, as far as sweating. So using fan and cooling pillow, and then keep water at the bedside. But you do want to limit drinking a large amount for about 1 hour before bedtime. But if you're somebody that's sweating a lot, just to take small sips throughout the night is fine. Managing anxiety and stress. So journaling at nighttime is a great way to just kind of get any worries off your chest, or setting a worry time earlier in the day is really nice. Some people, if you're religious, you know, praying, but try to, you know, keep all of your focus towards more gratitude and positive visualization. I always recommend, you know, by your bedside to put, you know, more uplifting pictures of, you know, family and friends, or you doing like really cool things, because just waking up in the middle of the night, you know, going through what, you know, thinking about what you're going through, just to have like a little visual to remind you of all the things you have, remind you of that gratitude, can really go a long way, not only for sleep, but just general stress management. Mind-body techniques. So I personally always use this 5-5-5 breathing technique whenever I wake up anxious, and very simple. 5 seconds breathing in, 5 seconds holding it, and 5 seconds breathing out. So we'll go ahead and just do 2 quick cycles of this. So I'll have everybody 5 seconds breathing in, 1, 2, 3, 4, 5. 5-second hold it, 1, 2, 3, 4, 5, and 5-second breathing out, 1, 2, 3, 4, 5. And again, 5-second breathing in, 1, 2, 3, 4, 5. 5-second holding, 1, 2, 3, 4, 5, and 5-second breathing out, 1, 2, 3, 4, 5. And hopefully, you know, everybody feels a little bit lighter. It's not, you know, an instantaneous relief, but I honestly, anytime I wake up, you know, with my head just going through everything, I do this, and it just is really helpful and calming. Other progressive muscle relaxation, that's related to just kind of channeling certain areas and certain muscle categories and relaxing them. And then guided imagery. There are a plethora of different meditation apps online. You can pay for resources. There's actually some resources here at the bottom. There's also on YouTube a lot of free options. You have to watch the ads usually, but it's really helpful. I mean, my husband suffers from anxiety, and he has it on his phone, and when he walks our dog, we'll listen to meditation and, just incorporate it if you're in the car for long amounts of time, especially if you're going to treatments and you're sitting on the 405 stressing you out, put on some meditative, and there's so many different options, whether it's talking through meditation or music. There's just a lot of wonderful options for whatever sort of meditation you like. Some people have a little bit of a bias against meditation, but it doesn't need to be, all Buddha. It can, there's so many different types of meditation out there to kind of fit everybody's needs. So if you've never tried it, I really recommend. And there's a lot of meditation apps that are just quick 10-minute meditation. It doesn't need to necessarily be, full hour or what have you. Also, yoga stretches. So this supine twist over here, right here. So that's one that I love if you're having any pain at bedtime, just in your bed, just put your leg over top and twist, and it's really helpful for any back pain. But again, you don't need to become a yogi with these poses, but just simple exercises are really great in calming. Herbal teas are fantastic. Chamomile teas I find are the best, especially Celestial Seasonings makes a sleepy time tea. To have that at nighttime, especially with it being cold. And honestly, the hot water, if you're not a tea drinker, we call it silver tea. Just hot water in itself is really helpful for calming, and it also just calms your digestion. So if you're somebody that, especially with certain treatments in the middle of the night, your stomach's rumbling, just drink some silver tea at nighttime, and it can go a long way into just calming your bowels. Also, aromatherapy, lavender and chamomile are the best aromatherapies to help specifically for sleep. Warm baths or showers before bedtime. So I have 2 young children. We give them a warm bath most nights before bed. Works in the same way with adults. It relaxes muscles, reduces fatigue, relieves headaches, reduces puffiness, reduces anxiety, releases nasal congestion. If you're ever congested, one of the best things you can do is a warm shower and just blow your nose and get it all out, because not only are you getting it out, but you're breathing in that humid air, and it can just really help kind of clear you out. Removes toxins from the skin and opens your pores. Conversely, a cold shower, if you're somebody that wakes up and you feel groggy, cold shower is very helpful in waking you up, stimulating your immune system, increasing alertness, preventing colds, stimulates antidepressant hormones, speeds metabolism, frees your mind, tightens the skin, and reduces hair loss. If you think cryotherapy, same sort of idea. You don't need to do a polar plunge, but this is, just a little bit colder can really help wake you up. So, one or both options are helpful for that sleeping. So talking about more non-pharmaceutical medications, melatonin, I'm sure most of us have heard of this. Over the counter, with supplements, since they're not FDA regulated, you'll find that based on how the composition of them, the dosages are a little bit different from, one brand to the next. So that's why it's hard sometimes when there's a recommendation for supplements, how it's, a lot of times we say, look at the back of the ingredients and see how it's giving, because we can say, if you're taking magnesium oxide this way, but a lot of supplements just say magnesium on them and don't actually say, the specific ingredients. And again, it's so different from one company to the next. Yes? Okay, so yeah, it is something that some people really, I'm sorry, he's this gentleman is commenting that he took melatonin and it was giving him bad dreams. So I don't know what dose you were taking. Usually, sometimes it can be anywhere from a 3 milligram to 10 milligram. You did 3 and 5? Okay. So yeah, some people, it can cause bad dreams. It can also cause daytime grogginess. If you do try bedtime for it to work and start at the lowest dose possible. Of daytime grogginess is not worth it. There's kind of suggestions about that. I don't know. Oh, sorry. Oh, yes. Can you hear me now? Sorry about that.
Okay.
Okay, thank you. Sorry, technical issues. All right, so melatonin, you can try it. It's kind of different for everybody. I personally have tried melatonin. It makes me very groggy during the day, so it's something that I don't take. What I do take is magnesium L-threonine B, and it's a specific type of magnesium that can help get you into that REM cycle. It's 200 to 400 milligrams daily. It's magnesium L-threonine. This one says a magnesium sleep X. But that is really helpful for me. I do want to say if you start taking this or any magnesium supplement, ask your doctor to check your magnesium levels. Because having too high of magnesium, magnesium kind of recently has been promoted as this cure-all. It is very helpful if you have low or even, normal magnesium levels. But if you get high magnesium levels, it can actually cause a lot of nausea and vomiting. So I recently had a patient who had a whole GI workup because she was really nauseous and, had to did a whole colonoscopy and everything, didn't find anything. And they found that she was taking a lot of magnesium supplements and, unfortunately kind of inducing this nausea because her magnesium level is off the charts. So again, very helpful, but just have, even if you're thinking about starting magnesium, just have them add on. Most people get CMPs drawn with their normal labs. Magnesium's actually not usually added into that CMP panel. So you can just ask, usually it doesn't even require an extra tube or any of that, but just ask for that to be added just so you can, and say, I'm starting to take magnesium supplements. Can you check this just to make sure that, again, either most people have low magnesium. That's why it's being promoted as, so helpful for patients, similar to, say, vitamin D. A lot of people tend to have low vitamin D levels, so a lot of people can benefit. But if you have, really high levels, not only are you having expensive urine, but, you might be causing kind of GI distress. Sorry, screen's stuck here. There we go. Okay, so another thing, over-the-counter sleep aids. Most of them are actually Benadryl or doxylamine. So it is 50 milligrams of Benadryl, or 2 of those pink capsules, is actually used for insomnia, but you're probably spending more money getting something that's a sleep aid that's just diphenhydramine. And it can also make you very groggy. Antihistamines, while they do have a purpose, they can also worsen confusion because they have the histamine component. They can dry out your mouth, your whole GI tract, and cause constipation. And some people actually get restless legs with Benadryl. So, I kind of hate that they market this as a sleep aid without actually, I mean, it does say what it is, but most people don't know that diphenhydramine is Benadryl, right? So if these work for you, they have a time and place, but I really would discourage against long-term use, especially as we get older, because that grogginess, you don't want to get up in the middle of the night to use the restroom and slip because, you're essentially being sedated. So when to consider medications with persistent insomnia despite lifestyle changes, severe impact on quality of life, and always use them under medical supervision. Common sleep medications are Ambien, Ativan, Lunesta, trazodones used off-label, as well as mirtazapine. There have been more and more recent studies, unfortunately, that have shown long-term use of these medications can contribute towards dementia. So, recently, a year ago, I had a patient who was diagnosed with cancer and then a week later lost her home in the Palisades fire. And, understandably was just so traumatized. She took Ambien for a short amount of time and took herself off of it, when appropriate. There is a time and place for this, but, please try all of these other ways first, because, certainly you don't want to build a dependence, and you don't want to contribute towards dementia or, any of these other side effects. And again, these medications can cause a lot of grogginess overnight, can lead to nighttime falls and such. So please just talk to your provider before starting any of these treatments. And when to seek help. So if you're having trouble falling or staying asleep over 3 nights a week for over 1 month, and that's not necessarily if you're having waking up to urinate, but if you're just waking up unprompted regularly, if you're having ongoing daytime sleepiness affecting daily life, these, of course, should be brought to your provider's attention. Certain medications, for example, gabapentin, which is used for a lot of neuropathy pain, it's a very effective medication, but it can contribute to drowsiness, especially if you're taking it in the morning. So simple things like even adjusting when you're taking medications can sometimes really help, not only with your quality of sleep, but also lessen that daytime drowsiness. Snoring, gasping, and pauses in breathing can possibly be linked to sleep apnea. Unfortunately, so many people go undiagnosed with sleep apnea, and a lot of people are resistant to getting tested. You used to have to get tested in the hospital. Some facilities still do it in that way, but more often nowadays they can do at-home testing. So, well, it's less than ideal. It is more, patient-friendly to get tested. And CPAP machines used to just be so bulky. Now they're much, much smaller. Again, something that your body would have to get used to. But more often than not, patients are just so happy once they get the diagnosis, once they start to use a CPAP machine, just with how it affects your quality of life. Usually I tell people to wait, give it a week before you really are able to get into that sleep cycle, because again, it can take some getting used to masks. These days, they're also much, much better at fitting CPAP machines than they used to be. But if you're waking up frequently, if you sleep next to a significant other and they're noticing that you're waking up throughout the night, if your snoring's worsening, and certainly if you're waking up ever gasping for air, it's worthwhile to get tested. And they not only test for sleep apnea, but other kind of sleep disturbances. All right, that's it. Do we have any questions? Thank you. Yes.
Yeah. So I don't have any problems getting to sleep, but I've done a sleep study that says that I don't enter deep sleep. How can I specifically.
Get a deeper sleep. Are you limiting the screen time and caffeine? A lot of times caffeine can be the culprit. And you know, unfortunately, caffeine's not only in coffee, you know, things like chocolate have caffeine, teas have caffeine. I should have mentioned with the teas, make sure it's an herbal tea, not a caffeinated tea. And are you exercising? I would say try to just incorporate all of those things and see if, you know, if it's not, none of that's helping, you might unfortunately be somebody that could benefit from a pharmaceutical medication, but I would try to boot. I know some people just sleep later than others. I'm always done. My husband goes to sleep and just is like out in 2 seconds. I don't know how if he does it, but some of it's genetic. Yes.
Does it also, because I don't think I have trouble before, but is it also because I'm close to approaching the, sorry, but I have to be honest, on the hormonal changes?
It could be, yeah. Sorry. So we have a question about if her sleep is impaired because of hormonal changes related to menopause. And menopause, unfortunately, it has been shown, you know, across the board, it affects sleep quality. So it's, you know, do your best trying to change your sheets, put a fan on you, and then incorporate, you know, just a better sleep schedule with, you know, before going to bedtime can help. But oh my, I have so many patients that, yeah, are going through menopause at the same time, especially when getting hormonal therapies that causes it. And it's unfortunately just a double whammy. So it's likely adding on to other problems. So I'm sorry that you're going through both of those, but just try to incorporate all of these things. And again, if it's not helping, you know, don't be ashamed if you do need to ask for a medication to help, but just try your best to, you know, limit that need.
We have a question online. Taking magnesium, is that a cautionary pill as much as the sleeping pills?
So magnesium, it's natural in your system, so it doesn't have an addictive property. But again, I would just have your doctor add a magnesium onto your next labs just to make sure that, you know, you're not overdoing it and that you're benefiting from the magnesium more than having any side effects. But no, it's not addictive. It doesn't, to my knowledge, there's no dementia correlation or any kind of addictive properties. Yes.
I read recently in a magazine that making a tea from the lettuce and it helps you to calm down and go to sleep.
Yes.
So, and it's no side effect doing that.
No, yeah, no, that's wonderful. So we had a question about using loose leaf tea to make tea, and that's fantastic. Lettuce. Oh, lettuce. Oh, okay. You know, I haven't heard of that. Yeah. I've heard of using cabbage before, for like cabbage soups to help with sleeping, but I mean, I bet that is also helpful. So wonderful. So anybody, yeah, try lettuce tea. Question? Oh, sorry. We have double.
Oh, for those of us who are not well informed, could you explain circadian rhythm and?
Oh, yes, I'm sorry. Yes, so circadian rhythm, so there's 4 different, if you look at a sleep cycle, for most people it's about 30 minutes, 30 to 45 minutes, sometimes can be up to an hour for a full sleep cycle, and it goes from stage 1, stage 2 REM sleep, which is that rapid eye movement. That's a lot of times associated with when we're dreaming. And then I want to say it's stage 4, but don't quote me. That's that last point when you're becoming more alert. So actually the stage 2 and REM is the most optimal time when we're in that deep sleep, that we're really getting the quality sleep. So now circadian rhythm goes along with when hormones are throughout the day. So when you wake up is when you have the highest cortisol level, for example, when you're most alert. And then throughout the day, your kind of hormones fluctuate. And then at the end of the day is when you're low on those hormones and wanting to get into sleep. That's why if you nap later in the day, it kind of makes your body think that you're going back into that sleep. And it can, in fact, when you wake up from that nap, if you're taking a longer nap, it can shoot cortisol back into your system and say, okay, it's time for me to wake up. And then lo and behold, at 2 o'clock in the morning, you're still wide awake because you still have that hormone fluctuation. So you want to try to optimize so that your hormones are in line, which is why a lot of people that work shift work for nighttime, night shifts, unfortunately have been shown to, have worse sleep quality and shorter lifespan because they're constantly affecting the circadian rhythm and unable to obtain these deeper sleeps.
That was just a follow-up question
Yeah.
about that. How can you tell if you have a good night's sleep?
So usually if you're waking up, feeling more rested, these days there's all sorts of I think your smart watches, can speak to it more. And then what is it, the Aura ring? There's all sorts of ways that you can see if you're getting a good night of sleep. I don't know the accuracy of those, but and also, if it's saying you got a good night of sleep, does that make you feel better? If it says you got a bad night of sleep, does that make you feel worse? I don't know. But I would just kind of leave it to how you're feeling in the morning, and just if you're able to fall asleep at a reasonable time. But again, everybody's different. Even when it says, a normal night of sleep is 7 to 9 hours, 2 hours is very different, for one person to the next. So everybody's different, but yeah, I would just gauge it on how you're feeling the morning after. Yes? Hi.
This is from personal experience and also my professional experience. I would just highly recommend that you advocate for yourself, that if you do feel that you need sleep medication, that you see an appropriate doctor that prescribes that medication. There are all kinds of doctors that will prescribe psychotropics. They do not have the advanced training in psychotropics. You really should see a psychiatrist, and you should advocate that for yourself to be referred to a psychiatrist that can manage that for you. And it's also not just getting prescribed medication and leaving it at that. You should have regular ongoing appointments with your psychiatrist. You should not see a psychiatrist who just says, here's some pills and I'll see you in 6 months. So please advocate for yourself and know the proper doctor that is the most appropriate to prescribe that kind of medication. I've spent 27 years advocating for healthcare and mental health care in underserved communities. So I know this happens a lot.
That's wonderful. So we have someone advocating towards seeing a psychiatrist when needing medications for sleep, specifically psychotropic medications, to advocate that you need to see a specialist and have regular follow-up with that specialist to make sure that you're taking it appropriately on the right dose, and that any adjustments need to be made. And I agree. Unfortunately, I think that there's a lot of benefit that can be from a lot of these telehealth online portals. However, there's not follow-up, and there's not a lot of regulation as far as certain controlled medications, and that's scary. So I can speak for, I work at UCLA, and it's a huge facility. So we do have a specific team of social workers, psychiatrists, psychologists, chaplains that work focus on mental health, on sleep quality. We have dietitians within that group as well. I don't know specifically at Torrance Memorial, or I know Cedars has a similar program, but a lot of times you can ask too within your facility, because it's really nice for us, for example, because the psychiatry team corresponds with the oncology team, and they're specific to oncology patients. So they know, they have an understanding of, the polypharmacy. It's just overwhelming. Unfortunately, some patients who come in just taking so many medications that they don't necessarily need to be taking. And again, I very much pride myself in a combination of Eastern and Western medicine. I work in cancer, obviously, but there's a lot of adjustments that can be made. And so I always think for any of your doctors, to have them look at your list of medications, specifically for primary care doctors, but to see if there's anything that you can come off of at any time, or, any adjustments that can be made. Or even, say if your doctor wants to start you on a blood pressure medication or on a statin for cholesterol, if you're motivated, see if you can make diet and lifestyle changes first, and return back in 2 months to see if you can start to do that. Unfortunately for most people, as we get older, you're going to need something for blood pressure, something for cholesterol, something for your thyroid. It's just it's a natural aging process, but if you can do other things, if you're motivated to do so, just to at least kick the can along and push it off a little bit longer, because you can look at the side effect profile for aspirin is astronomical, and it always ends in death. So it's terrifying, right? The pharmaceutical companies are required, if there's any, side effects, that they have to put in, the red lining, even when you watch television, and, all of the blah, 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 blah at the bottom, at the end of it, those are all of the side effects. So any medication comes with side effects. Obviously, again, I'm a proponent of Western medicine, but, I really, and, why is the bulk of this conversation is talking about things that you can do outside of needing extra medications, because I know, most of us are on more medications than we would like to be on right now. So, question in the back? Yes, yes. Sorry. Does localized radiation cause insomnia around the head? Yes, it can. And a big reason for this is because the way that it works can cause inflammation initially, and then can dry out all of your mucous membranes. So if any of us have ever had dry eyes, you're not sleeping as well. You're also, during REM sleep, that rapid eye movement, you're not able to move your eye as well. For salivary, if you have dry mouth, you're not sleeping as well, because you're not breathing as well as you should be. So yes, absolutely. I think sometimes people think radiation, it's localized, very effective, but it does really affect systemically. So yeah, yes, it's normal to have sleep problems with that. And usually radiation oncologists, if you explain that you're having dry eyes, or dry mouth, or any itching anywhere related to the radiation, they usually have a plethora of resources and recommendations as far as different creams, different biotin, or things to help lubricate your mouth, or eye drops for your eyes that can help, at least for the time being. Yes.
So I often have problems actually waking up.
Mhm.
I'll very often sleep through alarms.
Okay.
So I'm not sure how I can more easily get out of sleep and out of bed.
Yeah, so the gentleman who had said earlier that you have trouble getting into that deep sleep, but getting to that deep sleep later in that sleep cycle and have difficulty waking up. So it sounds like your sleep cycle is just skewed. Do you know when you usually fall asleep about?
10:30 or 11.
Okay. So 10:30 or 11 is when he goes to sleep. That's a reasonable time. I would try to just push everything earlier in the day. So, even starting winding down at 8 p.m. screens, go to old school pen and paper writing, or I like to paint. I'll do painting at nighttime. It's very therapeutic. Or yeah, just reading is a great way. Get a cup of tea, do some reading, and you can even just trial it out for a week and, just kind of give yourself an early 8 p.m. This is when, I'm starting my nighttime routine, and see if it helps. Because, hopefully it does, but if not, try something else. But it sounds like, yeah, you just need to start all of those habits a little bit earlier. And then, yeah. Now, there's been studies that say, if you're in bed for an hour and a half, that can kind of affect your ability, similar to if you're working in bed or using bed for, other things that your body doesn't necessarily know, okay, this is bedtime right now. So yeah, try to stay in bed for, an hour or less before you want to actually go to bed. Otherwise, you can do things like reading, just sitting up, or,
How long is long-term use? Because right now I'm on mirtazapine,
Mhm.
and now I heard from you that it may cause, it may lead to dementia. Problem is, when I started my treatment,
Mhm.
I couldn't sleep, I couldn't eat. So that's why my palliative care nurse prescribed this
Mhm.
mirtazapine. So it helped me. So I gained weight, I was able to sleep. But the thing is, I'm alarmed because my father died at the age of 63 from Alzheimer's disease,
Mhm.
and my mother died at 87 from dementia.
Mhm.
So now it's kind of like I'm down if I don't take mirtazapine to help
Yeah.
me during my treatment, and I'm down if I do. So
Mhm.
I'm like, when do I stop taking it? Because for as long as I am on treatment, because that's one of the side effects
Mhm.
of the drug. So please.
You can summarize for this.
Yeah, so we have an attendee who's been on mirtazapine for a long time. How long is it? Has you
I
been?
started like probably September.
September? Okay. Since September, and is concerned because she has a family history of Alzheimer's and dementia. So for how long is too long. So, obviously there's not a black and white answer for this, but I would say since September, try to limit the use of these medications to under 6 months. So you're, at that 6-month timestamp. There's still a lot of research happening for how these medications can cause dementia. So I think, hopefully in the next year or so, we'll know more about, what the other side effects of them are. But I would ask, I don't know if where you're treated, if they do have a psychiatry